Say the back.
Gotta see who she is.
Topic. A lot of difficult terms, and they were pronounced nicely.
Okay, that should be enough.
Such a cool.
All right, 1, 2, 3, 4, 7, 9, plus the cameraman.
My name is Letisha Smith, and today I am going to talk to you all about infertility in women. The most frustrating time of a woman's life is when she finds out that she cannot conceive. Every woman's dream is to have a baby. Every husband's dream is for his wife to have a child. The frustrations that a woman feels when she finds out that she's infertile is beyond belief. I mean, she starts lashing out. Her hormones are so out of whack, and it's just a frustrating time of a woman's life. So today I'm going to enlighten you on infertility, that some of the common causes and some of the common treatments for infertility. Some of the common causes for infertility is polycystic ovarian syndrome and blocked fallopian tubes. Polycystic ovarian syndrome causes a hormonal imbalance because of the body's blood sugar control system, and it causes cysts on the ovaries. As you can see, you have a normal ovary and you have a polycystic ovary. The little blue is the cyst that grows on the ovaries. The common symptoms for polycystic ovarian syndrome is excessive hair growth, hormones fluctuating, and irregular menstrual periods. Sometimes she won't have a period for 2 to 3 months here, and then she finally has one, and then there's another break in her cycle. So she wouldn't, during that time, she doesn't know what time that she's actually ovulating. Next is blocked fallopian tubes. Blocked fallopian tubes is caused by scar tissue building up in the fallopian tubes. As you can see here, the scar tissue can, it pretty much is caused by infection, pelvic inflammatory disease, and a lot of women, once they have blocked fallopian tubes, it can cause an ectopic pregnancy because the egg goes through the fallopian tube, but it embeds itself in the inside of the lining of the fallopian tube. And the ectopic pregnancy is very serious because if the ectopic pregnancy, if it ruptures, it can cause bleeding, and you can also die from ectopic pregnancies. Some of the common treatments for infertility is you have surgery, which actually clears out the scar tissue, and you also have Clomid, which is an actual drug. And what Clomid does is it levels out the cycle as far as your FSH and your LH levels. When the FSH and the LH is at the peak, that means that the woman is ovulating. Once the Clomid actually makes her have that peak. FSH and LH, it also determines whether a woman's ovaries is failing or the causes of the failure. The starting dosage for Clomid is 50 milligrams. When you have your doctor the doctor will actually send a woman through a phase called a Clomid challenge. And in the Clomid challenge, they monitor the FSH and the LH levels to determine when a woman is ovulating, and lets her know, so during that time, she'll know when to have intercourse. Another medication is metformin. Now, metformin is not used as an infertility drug. It's actually used to help the insulin levels, and it's used to help polycystic ovarian syndrome. With the metformin, most people classify metformin in the same category as Clomid, but do not be mistaken, because it is totally two different types of medications. Clomid helps ovulation. Metformin is mostly used to regulate the menstrual cycle. A lot of women with PCOS, as I said before, use metformin it keeps down the cyst that grows on the ovaries, and it also helps with the ovulation process, but it don't technically make you ovulate. So if you put Clomid and metformin together, most likely a woman is guaranteed to ovulate. So, in conclusion to this, being frustrated because of a woman not being pregnant is very serious. My experiences, I've dealt with from the raising of the hormones to the lowering of the hormones. And if you or your significant other ever come to the point of infertility, just remind them that there's there's medications that they can take, and also different types of treatments that they can use to help the conditions. And this concludes.